Hello, this simulation is an example of team nursing approach to a non-COVID patient during a pandemic setting. I'm Kate and I'll be Nurse A today.
My name's Michael and I will be Nurse B.
Alright, so we'll start off with our first section. I'm completing the safety checks and my alarm settings, so I'll talk you through that as I go. Coming into the bed space, gelling my hands before contact with the environment, checking my evacuation equipment in the bottom drawer.
While Kate is doing that, I will be looking through our medication chart, seeing when medications are needing to be given, and then once I've got that written on a plan that we're going to be using for each bed space, I will go off and grab those while Kate completes her assessment.
Alright, moving back to the bed space, we're moving on to our monitors and our ventilator. Checking our alarm limits, we want these parameters set very tightly. You'll be stepping away from the bed space, so you want to make sure that you're notified if anything goes outside of the limits that you're happy with.
While Kate's doing that, I will step away and I will gather these equipments.
Moving around to the back of the bed space, same as our normal safety checks. Checking your ambi bag, and your suction, oxygen tank, zeroing your end tidal CO2, your arterial line and your CVP. Moving to the far side of the room here, check your airway adjuncts and your infusions.
8 AM Panadol, antibiotics that will be due.
Alright, then we'll work as a team to finish our daily plan. I will call out the levels of our infusions and when they're due. This is a safety measure so that when we move away from the bed space, we know how much time we have left. Alright, Michael, so we have propofol running at 20 mils an hour. We have 40 mils left in the pump. So on our plan, due in 2 hours. We also have noradrenaline running at 10 mils an hour. That has 20 mils left, so also due in 2 hours. In your plan, you also want to include any line changes that are necessary. So our propofol line is due for a change at 3 o'clock today.
3 o'clock.
And NORAD 12 midday.
Alright,
Is that our plan complete, Michael?
that is our plan complete.
Perfect. I'll move on to now a quick head-to-toe assessment of my patient. So I'll just move around the other side of the bed.
While Kate is doing that, I will document all vital signs down on our OBS chart. Can you turn the screen around a little bit, please,
Of course. Here we go.
Thank you.
Alright, coming over to our patient, doing a quick check of our tube, checking we're happy with how tight it is, and then moving on to our quick head-to-toe assessment. So doing our GCS. Gary, can you open your eyes for me? Gary, can you open your eyes? No response there. Central painful stimulus, good squeeze. Gary, can you open your eyes? Gary, open your eyes for me. No response there. Michael, our GCS is a 3. Just checking our pupils. Gary, just having a wee look in your eyes here. Have a look, bright light. Pupils are 3, sluggish reaction. Popping a thermometer in. Michael and I are working as a team here, so as I do my assessment, I'm calling my findings out so that Michael can document them, making our care far more efficient. auscultating lung sounds. Chest is clear, Michael. Hypoactive bowel sounds. Soft abdo. Temperature 36. Having a quick feel of peripheral pulses. Cap refill. Our patient has good peripheral pulses in both arms. Nice and warm, pink, well perfused. Cap refill, 3 seconds. Having a wee look at his legs. Imaginary here with this mannequin. Good peripheral pulses in both feet. Warm as well. Cap refill, also 3 seconds. Happy with our patient assessment there, Michael?
I am happy. Are you happy to tell me what that cuff pressure was in the time that I was not here?
Thanks for the prompting. I missed that. So our tube is size 7. We're 20 at the teeth. Cuff pressure 22.
Perfect.
Lovely. Once we're both happy, that brings us to the end of section A. Alright, so we're moving on to section B. This is our first grouping of patient cares. Michael and I have popped on gown and gloves for patient contact. My main jobs here are NG cares, while Michael prepares for our turn, which will be in the next section. We'll talk you through each thing as we do it. So I'm getting the medications that are due at 8 o'clock that Michael bought for me in the last section. NG tapes and scissors, and then moving to the cares trolley at the back of the room.
While Kate's doing that, slidey sheets, clean sheet, and of course some pillows that we're going to use for repositioning of our patient. While Kate's doing that, I will be at least getting a sheet ready on the side of our patient here so that when we do our turn, we will be able to do a simple turn and pulling our sheets out. While doing this, we will be leaving an X-ray slidey underneath our patient in case they do need a chest X-ray at any point during the next shift.
I start off by doing an NG aspirate and then giving any NG meds and a flush. Once that's completed, I then move on and change the NG tape. My last job here is eye and mouth care. We'll be doing teeth once a shift at set times. Sorry Gary, just some quick gel in your eyes.
While Kate's doing this, I will go and gather a third person so that we are ready to do our turn and get our patient properly positioned.
And that's the completion of section B. Alright, moving on to section C. This is our next grouped gears. This involves changing ET tapes and doing the turn that Michael's just prepped for. So we'll get started doing tapes. Michael, are you happy to hold our tube there?
I have got that tube secured and we were 20 centimetres at our teeth.
Perfect, that's great. Alright, loosening the tapes there. And the far side. Looks great. Grabbing the new set that you got ready earlier. Just bringing those through. Popping a bit of lip balm on the corners of the mouth. Trimming that tape down. Checking those are nice and secure, one finger under each side.
And remaining 20 centimetres at our teeth.
Great.
And now that we've done that, just in time for our third person to help with our turn.
Hey guys, you ready?
Yeah.
We are ready. So if you
Okay.
pop over this side, Lindsay, we're going to be turning over
To face you?
Yeah.
Fabulous.
Thanks for coming to help us.
That's okay, that's what I'm here for.
So Michael's prepped, pop some slides in there. We will turn towards you two.
Yeah,
I'll do a quick skin assessment, bit of a clean, pull the new sheet through. We'll come back, reposition the slides, and then one more turn.
great
Everyone
stuff.
happy?
While you lower the head of the bed, I will secure the tube.
Just make sure that this is all right.
Alright.
Right, and that bed height is all right for you, Lindsay?
Yeah, that
Is
works
that
well
okay?
for me.
Yeah?
You've got that tube?
I have
Yeah.
that tube.
Okay, so on 3. 1, 2, 3.
Fantastic. Okay. Alright, skin looks good. Giving a quick freshen up. Bringing that old sheet out. Fresh sheet through. Slidies and the fresh greenie. Okay, ready to come back down when you're all ready.
Okay, on your pound.
On 3, we'll go back down. 1, 2, 3.
Fantastic. So, if we move up the bed about 5
I
centimetres,
feel happy taking that airway, Lindsay, while
Yeah,
we do this.
I can.
there's the top slide here.
Thank you. Okay, okay sir, we're just going to move up the bed. Okay, on 3. 1, 2, 3. Great.
And coming over towards me.
On 1, 2, 3.
Perfect. Now if we cut those slides
I'll
through.
keep hold of this tube.
Beautiful.
Just making you nice and comfortable now, sir.
Alright, we've got our pillows here prepped that Michael did in the last section. Do one last turn and pop those in.
Okay, guys. So on 3, we'll go up to 90. 1, 2, 3.
Bringing those slides out, leaving the X-ray one in. Just get that greenie there, Michael. And we'll pop this pillow in. Okay, there we go, all ready when you are.
Okay, I will go back on 3. 1, 2, 3. Great.
Okay, Lindsay, if you're happy holding that tube, I'll just sit him up here.
Great.
Keep coming up.
There we go.
Repositioning the sense probe to its other ear.
Our last part of section C is we do a quick run through, checking we're happy with all safety measures before we step away from this bed space. So we recheck the tube positioning, that we're ventilating okay, all monitoring's on, and that we're happy. We've set those parameters so we know we'll be notified if anything goes out of the limits that we've set. And then lastly, Michael calls out the safety checklist that I've done in the first section to run through quickly before we step away.
Patient ID in place.
Yes.
Ambu bag, mask and airway at the bedside.
Yes.
Personal eye protection and a face shield.
Yes.
Ventilator alarm set.
Yes.
Oral suction connected and on a regular suction.
Yes.
Full O2 cylinder.
Yes.
Monitor alarms are set at appropriate limits.
Yes.
Electrical equipment is all plugged in.
Yes.
Call bell readily accessible. In this case, probably not.
Not applicable.
Transducers levelled and calibrated.
Yes.
Drug infusions checked.
Yes.
Hi everyone, coming to the next
Evacuation
training.
equipment.
We're about to
Yes.
start now. Cheers.
Stethoscope.
Yes.
And no drug allergies documented on the drug chart.
That's right. That brings us to the end of section C.